Welcome back to the equine anatomy lectures. This is the second part of the male genital tract after we finish the head and the neck, thorax, abdominal cavity, and female reproductive organs. In the first lecture, we've talked about why studying the equine male reproductive tract is important clinically. We talked about a number of procedures, and I focused on two of them, cryptorchids and castration. Today, I will continue on the topic, and we finished last time by talking about the testes. After we talked about castration, I mentioned that sometimes we will have a defect in the testes, and that is by the presence of one or two lateral extra branches of the testicular artery. And these testicular artery branches basically cause sterility in these horses. So we have to detect them first, and then after that we have to remove them. And so let's take a look at where they are located first. This is a picture of the testicular artery coming to supply the testes right here, and this is the epididymis, of course, and this is the sometimes you will have one lateral branch as you can see here, and sometimes you can see two lateral branches as you can see in this picture here. So what we do is we basically take a biopsy from these testes, and we see if they are fertile or if they are sterile, if they are able to produce sperms or if they are not through the biopsy. We do the ultrasound first. As you can see here, the probe is basically uh, uh, put on the scrotum, and then once we see the two branches of the testicular artery, or the one lateral branch or the two lateral branches, what we do is we scrub the area clean, for surgically prep basically, and then with a true cut needle we get into the testicle, and we take a sample so we can examine it histopathologically. Once we finish that, we confirm that if this testicle is basically productive or not productive, can produce sperms or cannot, sterile or fertile, basically. Now we finished to talk about the testes. We'll talk about the next topic, and that is the epididymis. This is a picture of the epididymis, which is attached to the testicle, and the epididymis consists of a head, a body, and a tail. Of course, once the sperm cells are produced in the testes, they travel along the epididymis to basically go to the ductus deferens to be ready for ejaculation. Um, the tail is basically the site where the sperms get stored before the ejaculation. Now, when the sperms get into the ductus deferens, this helps the sperm to get mature, and it concentrates the testicular fluids basically, and protects the sperms in this side before the ejaculation takes place. Um, Next, we will talk about the accessory sex glands. We have 4 sex glands in the horse. We have the ampulla of the ductus deferens. We have the vascular gland. We have the prostate. We have the bulbourethral gland. ampulla of the ductus deferens, and that's where sperms are being stored. We just said that. Vascular gland is where the seminal vesicles are. The prostate gland secretes alkaline secretions to basically keep the sperms vital and alive. Now, let's take another look at where these glands are located. This is where these glands are located. This is the penis, and this is the retractor muscles of the penis. Now, here you have the bulbourethral gland. Here you have the prostate. Here you have the vascular gland, and here you have the ampulla of the ductus deferens. Now, I would like to focus on the body of the prostate. At the body of the prostate, which presses on the urethra and decreases the size of the lumen of the urethra significantly. This is a very important point because when we pass a catheter to catheterize the urinary bladder in the horse, this side here, because of the body of the prostate, the lumen of the urethra here is very small compared to the rest of the urethra in the remaining of the penile tissue. So here we have to be very careful not to push and not to cause any injuries in this area. The main function of these glands is to produce a portion of the seminal fluid, which performs the following functions. It helps to move the sperm through the urethra, provides nutrients to the sperms, and stimulate metabolism and motility, and buffers the environment, which rapidly changes as the sperm progresses through the vas deferens into the female's reproductive tract. These are the functions that the seminal fluid, which is produced by these glands, do. I said earlier that in the ampulla, the sperm is stored before ejaculation. The seminal vesicle adds gel volume for the ejaculate. The prostate produces pre-sperm fraction of the pre-ejaculates, and the bulbourethral gland, along with the other three glands, produces the seminal fluid. This is basically what these glands does. Now, again, the body of the prostate presses on the urethra and decreases the size of the lumen significantly, which makes it pretty difficult to pass the urinary catheter to catheterize the bladder. the penis. The penis consists of three parts: the root, the body, and the glands. Root, body, and glands. When flaccid, the penis lies within the prepuce, and it's approximately 2 to 6 centimeters in diameter and about 50 centimeters in length. There's about 15 to 20 centimeter free in the prepuce. When erected, the penis can double its length and thickness. Now, the penis consists of the following layers: the ischiocavernosus muscle, the tunica albuginea, corpus cavernosum, corpus spongiosum, urethra, bulbospongiosus, and the two retractor penile muscles ventrally to retract the penis. So mostly it's an ischiocavernosus muscle. Ischiocavernosus muscle. This muscle attaches the penis to the pelvis or the pelvic rim. Now, at this level, as well as the level of the body of the prostate, the urethra is reduced in diameter from 6 centimeter to about 1 to 2 centimeters. Again, I will repeat that. The ischiocavernosus muscle attaches the penis to the floor of the pelvic bone, the pelvis. At this attachment, at this very specific attachment, it reduces the diameter of the urethra from 6 centimeter to 1 or 2 centimeters. So it reduces the diameter, which makes it extremely harsh for the catheter, for the urinary catheter to pass. Similar to what the body of the prostate does exactly. It reduces the diameter of the urethra. This is very important, and that's why I'm repeating this. So 2 places reduces the diameter of the urethra. One, the body of the prostate, and the other is the ischiocavernosus muscle attachment to the pelvic bone. Very important. Now, the erectile tissue of the penis is the corpus cavernosum, which is filled with blood, and it extends, of course, during the erection, and it's surrounded by the tunica albuginea, number 1 in this case. And this is a fibroelastic tissue surrounding the corpus spongiosum now, which is a 3, is the bulbospongiosus muscle, is the urethra. On the ventral aspect of the penis is the retractor penis muscle, which retracts the penis into the prepuce. This is another magnified view of the same picture. The body of the penis is made of the corpus cavernosum. Corpus cavernosum, which is this body right here. Here and here. This is surrounding by the tunica albuginea. Ventrally, you have the two here, and here you have the retractor penile muscle, and this is the urethra. Now, this is another view with the glans penis, the body, and the root cannot be seen in this picture. And this is the external pudendal venous plexus, which basically is filled with blood during the erection, as well as the musculo-cavernous tissue of the penis, which is all covered by the skin of the prepuce. The action of this muscle, as well as, or the action of this venous plexus, as well as the gracilis muscles, basically retracts the blood into the veins slowly. This picture shows the urethrostomy site, surgical site. Cases of stones in horses, you have to basically help voiding the urine. So the site is about 10 centimeters ventral to the pelvic brim, or to the pelvic bone. 10 centimeters is where you have to open, and also that would help to basically the urine to go ventrally toward the outside. In addition to that, it also bypasses the two places, or avoid the two places. It avoids the two places that I've talked about, which is basically the level of the issue cavernosus muscle attachment to the pelvic bone, as well as the body of the prostate, where you have stenosis in the urethra. So you don't want that to be in the surgical side. So you expose the urethra, you open in this area here, 10 centimeters ventral to the pelvic bone. You, when you open, of course, before that you insert a catheter so you can see what you're doing, and then you open. Once you open, you expose the urethra, which is seen here, and this is the basically the tube that the catheter that you placed, so you can see the urethra clearly. And here's the urethra opened and attached to the two sides of the skin, basically. And this is the area of the catheter basically being inserted into the bladder. And you can, of course, eliminate the penis because here the urine is going to be basically the path of the urine will be basically changed, so it's not going to be through the penis, it's going to be through the opening that you created, basically. So that's urethrostomy in horses, and this is the surgery. So basically, the animal starts urinating from this opening that you created 10 centimeters ventral to the pelvic bone. The penis also has the prepuce, as I mentioned earlier, and so the prepuce is this fold right here, the skin that covers the penis, the glans penis, and the urethra, and here you have what we call the fossa of the glans. The fossa of the glands sometimes accumulates a number of dead cells and sweat glands and things like that, which sometimes they dry. They call them smegma. So before the breeding season, these areas must be cleaned from any smegmas and anything like that. Usually, it's in the fossa glandis. They accumulate mostly in the fossa glandis. This is basically what it looks like here. So it can harbor infection, can have beans of the penis. They call it smegma, beans of the penis. So it harbors infection, it harbors bacteria, things like that. So you don't want that to happen during the breeding season, because this is going to be transmitted to the female. A number of cases that affect the penile tissue: preputial edema, paraphimosis, the inability to go back to normal. Basically, the penis stays, ventrally. Tumors, frostbites, lacerations, all kinds of injuries. The reason why is because the penis is exposed to the outside environment, so it has a more chance for getting injured, basically. So this is something. This is the preputial edema, something like this caused by trauma uh, of anything from other horses, from the horse itself, a kick or something, and it causes this. Sometimes biting by mosquitoes and things like that can cause this. Uh, Paraphimosis is something like this: the inability of the penis to retract back in the sheet, and that's pretty dangerous, because it exposes the penis to infections and trauma and other things. Uh, Tumors, melanomas, squamous cell carcinomas, any kinds of tumor can affect the penile tissue. This is preputial tumors. These are melanomas, basically, that needs to be removed, and the horse needs to be cleaned from these lesions right here. This is frostbite. Cold weather sometimes, minus 60 degrees wind chill, Indiana, Illinois, things like that. In the field, and the horse is mismanaged or ignored for a while, can cause these lesions, which needs to be taken care of. Same thing here with penile laceration. Again, the penis is exposed to the outside environment, so injuries and lacerations can happen all the time. With that, I conclude the end of the male reproductive tract. Uh, uh, Most important things are the cryptorchid cases, the castrations, urethrotomy, urethrostomy, castration, uh, a, um, uh, uh, passing a urinary catheter. Um, all of these are important things that we need to pay attention to as practitioners. So next topic, we will talk about the equine limbs, the hind limbs and the forelimbs. We'll start with the forelimb, and then we'll go to the hind limbs.